Well, for many, Breast Cancer Awareness Month is a reminder to get your yearly screening mammogram. But there are some different types of mammograms available. So how do you know which one is right for you? Well, joining me right now is Dr. Will Doby, lead interpreting radiologist at Baylor Scott & White Hillcrest Breast Center. Now, you have some questions that folks have about these mammograms. What are some of those top questions for you?
The main one is when to screen, when to start screening, and how often to screen. And part of the reason for that is there have been a lot of entities that have come out with recommendations. But still, the best recommendations, based on the best data that we have over 50 years of studying mammograms, and currently endorsed by the American College of Radiology, the American College of Surgeons, the American Society of Breast Surgeons, and the Society of Breast Imagers, is that beginning at age 40, women get yearly mammograms, one a year screening mammograms.
Okay, well, what if folks have questions? So they hear that breast cancer runs in their family. It might run a little bit earlier than 40. What does that look like with mammograms?
Right, absolutely. So that's when a patient needs to speak with their physician and determine if they need to start screening earlier based on their family history. And they may also qualify for genetic testing, which could alert them that they are predisposed to breast cancer and may need additional screening.
So what are some other trends when it comes to mammograms that might be a little bit different from mammograms?
So a newer technique on the market is 3D mammograms, or breast tomosynthesis. And basically what that allows us to do is to get past one of the limitations of mammography, and that is overlapping tissue in patients that have dense breast tissue. And tomosynthesis allows us to view the breast in slices and take away some of that overlapping tissue. That allows us to find cancers that could be masked or obscured by the dense breast tissue.
Do you have any warning against these things?
Against mammograms? No, absolutely not. Studies have shown that the benefit of mammography in women over age 40 is significantly outweighs any risks that there may be. The risks are extremely low. The radiation dose to the breast is extremely low.
And where can folks learn more or gather an appointment for a mammogram?
They can call the Baylor Scott & White Hillcrest Breast Center. That number hopefully will be at the bottom of the screen. It's 254-202-4220. And then there's also a website that you can go to, BSW Health.
So what are some of the big questions that folks come in with when they're trying to get their mammograms?
There's a lot of misinformation out there. There have been some marketing ploys for patients to go to a hotel room on a certain date or a hotel in town on a certain date and get screening ultrasounds, and they say these are cheaper and less. I guess less of a burden than mammograms. The problem is they're not mammograms. There is no substitution for mammograms. Bottom line, there's no substitution. Breast ultrasound is great as an adjuvant or an additional screening technique for mammograms in patients with high risk or extremely dense breast tissue, but they are by no means a substitution for mammogram. There are none.
Very good warning there, doctor. Thank you so much. Thanks for joining us today.
Thank you for having me.